Now, one of the most important tools in fighting the coronavirus pandemic is testing, detecting the virus. But that's expensive and time-consuming, and many health authorities are struggling with capacity. Well, now, researchers in Finland are working on a much cheaper but still reliable alternative. Take a look.
For a treat, preferably cat food, this snout can be programmed to find just about anything: mold, bedbugs, cancer. Now it could change the course of coronavirus detection. Meet Küssi. Rescued from being euthanized as a puppy in Spain, he's returned that favor for years, sniffing out deadly disease for the Wise Nose Smell Detection Association in Finland. As COVID-19 began to spread, Küssi was asked as an experiment to try to detect it.
It took about 7 minutes to figure out that, okay, this is what they want me to look out for. So that totally blew our minds.
Have you ever seen a dog be able to change training scents in 7 minutes?
No. No, never.
The team quickly learned canines can detect a COVID-19 infection even 5 days before symptoms appear, with almost 100% accuracy. Helsinki Airport is hosting a pilot project through December that will include cross-referencing canine results with those from medical devices.
It needs to touch the skin, so here.
It just takes a simple swab from a wrist or neck.
That's good. And then to the jar, yes. Then just wait a couple of seconds.
A dog can tell immediately if a person has contracted coronavirus.
All right, thank you.
So I received a negative result.
The voluntary tests are proving popular, but no positive signal yet from the Finnish government about scaling up the program. So since dogs are incredibly more effective, much less expensive, and far less intrusive than other ways of detecting the virus, why aren't public authorities everywhere rushing to use their noses instead of ours? We found one who is. Timo Arenkytte is deputy mayor of Vantaa, the site of the airport.
I considered it in 2 minutes. It took me 2 minutes.
Arenkytte's budget covers the free tests offered to all arriving passengers. He allocated 330,000 euros total to the 4-month dog study. Meanwhile, he expects it will cost up to 3 million euros per month for the medical option, the nasal swab.
It's quite expensive operation, of course, and the dogs are like 75,000 now a month.
Arenkytte says the data from this study should help bring in federal funds for expansion of canine testing, as well as legal adjustments to upgrade the virus-sniffing dogs' authority to that of their counterparts working in customs.
We can have like multi-dogs, which have like, they can smell hashish and they can smell COVID both.
Anna Björkman is thinking far beyond airports.
We could train dogs with the same samples, with the same trainers, to open up, the concert halls or big fairs, or go to big working places, hospitals, elderly homes, football matches, whatever.
Both Björkman and Paavilainen warn if Finland doesn't harness the potential of the dog program itself, they'll unleash it elsewhere.
We can move because Küssi loves warm weather.
She says health authorities from all over the world want to learn what these noses know.
Terry Schultz there reporting for you. And we are joined now by Terry from Brussels. Again, Terry, man's best friend, coming to us humans to our rescue. I know you addressed that in your report, the fact that, well, why don't we use sniffer dogs just everywhere? Can you flesh that out for us a little bit? What's the problem? What's the holdup?
You know, Layla, I still don't have the answer to that question, even after visiting Helsinki, because all of the people working on the project and the deputy mayor you saw are all in favor of it. Why wouldn't you spend millions less, get your results in seconds, and, swab your wrist instead of having your nose plunged? Everyone there, including all of the passengers I spoke with, would much rather use the dog test. Now, the veterinary researcher, Dr. Björkman, admits that once she figured out the dogs could do this, she didn't wait to do lab tests and get peer-reviewed and published. She tried to figure out how to put the dogs on the job. And she admits it would be easier to sell the project to politicians, if she had a pile of research to hand them. But she doesn't yet until this pilot project is over. She thinks perhaps doctors just don't want to give up the power of disease detection to a dog handler.
Is Finland the only place where this pilot is taking place?
Finland's got this 4-month study underway now in which they'll match up the results from the dogs with the PCR tests, the nasal swabs, and then they'll have this set of data that they hope will really get them some federal funding. Another place that the dogs are being used is the United Arab Emirates, who also found out within a 1-week test that the dogs had such a high level of accuracy, you know, between 95 and 100% accuracy. So the UAE is using them. But interestingly, Germany at the University of Hanover, they also had amazing results with a dog test, and yet no politicians came to pick up the program. So they've got dogs trained, willing to do the job, who are just sitting there waiting to be used.
Well, do you think they might actually have to, that their hand is forced and they might have to use these sniffer dogs? I mean, as you know, we have a second wave washing over us. Testing capacity is, well, strained, so they may have to.
Well, I'm talking to you right now from a country where they've decided not to test anybody without an active infection, which, you know, seems to be self-defeating under the circumstances. So a country like Belgium with some of the worst COVID rates could certainly use a system to get them out from under this overwhelming processing time. But so far, even in Finland, where they have these very promising results where you can see on the ground it's working, they have not been picked up for federal funding. Now, Susanna Pavalainen, the woman you see there with Kussi, who adopted him and trained him, says that it would be her dream that governments all over the world would realize the potential of this, and she could go clean out shelters and train dogs to be lifesavers themselves.
I know that could be a potential game changer right there. Thank you, Terry Schultz, for your excellent reporting. Thank you.